My name is Leslie Alvarez, and my topic is germline mutation in predisposition genes in pediatric cancer. Definition: the prevalence and spectrum of predisposing mutation among children and adolescents with cancer are largely unknown. Knowledge of such mutations may improve the understanding of tumorigenesis, direct patient care, and enable genetic counseling of patients and families.
When a parent is first given that information that their child has cancer, one of the first questions that comes to their mind is, why my child?
For many years, the scientific community reasoned that the genetic changes that cause pediatric cancer were simply unpredictable. Results of a new study by St. Jude Children's Research Hospital and Washington University, published in the New England Journal of Medicine, are changing the way we think about this question.
We pursued a study where we analyzed the genome, the normal tissue, from 1,120 pediatric cancer patients and asked, are there mutations in true cancer predisposition genes? And our finding was really very surprising. It was that 8.5% of children with pediatric cancer have a hereditary cancer predisposition.
Applications in medicine. It's essential for childhood cancer survivors to receive follow-up care to monitor their health after completing treatment. All survivors should have a treatment summary and a survivorship care plan.
Cancer is a group of over 100 diseases characterized by abnormal, uncontrolled cell growth. In a healthy body, cells grow, die, and are replaced in a very controlled way. Damage or change in the genetic material of cells by environmental or internal factors sometimes results in cells that do not die and continue to multiply until a mass of cancer cells or a tumor develops. Most cancer-related deaths are due to metastasis, malignant cells that penetrate into the circulatory system and establish colonies in other parts of the body. Great advancements have been made, but cancer is still the leading cause of death for people under the age of 85. In the United States, 1 in every 4 people die from cancer.
Pros and cons. The pathogenicity of the mutation could be determined by a panel of medical experts with the use of cancer-specific and locus-specific genetic databases. The medical literature, computational predictions, and second hits identified in the tumor genome. A cancer diagnosis is upsetting at any age, but especially so when the patient is a child. Continue unexplained weight loss, headache, often with early morning vomiting, increased swelling of persistent pain in bones, joints, back or legs, lumps or map, especially in the abdomen, neck, chest, pelvis, or armpits, development of excessive bruising, bleeding, or rash, constant infections.
Children live the life of dreamers, but in a heartbeat, all that can change. Every 2 minutes, a parent somewhere in the world hears, "Your child has cancer." These 4 words change everything. Parents' time is torn between hospital, home, and work. Brothers and sisters feel left out and left behind. The child with cancer misses out on school and spending time with friends. Treatment takes over their life. The child is poked, prodded, and exposed to harmful radiation. Harsh chemicals are injected into their bodies. They lose their hair, eyelashes, eyebrows, limbs are removed, organs are cut out. The path to survival is a brutal, dangerous road. And sometimes, cancer does have the last word. 1 in 5 children diagnosed with cancer in the US and Canada will not survive.
Issue applied in Ecuador. In our country, the rate of incidence of childhood cancer in Solca has been in the year of 2009 with 83 cases, in 2010 with 87 cases, and 2011 with 90 cases. Actually, this organization gives the hope of cure in 70% if it's early detected with a correct treatment.
I'm Dave Williams. I'm the Leland Fikes Professor of Pediatrics at Harvard Medical School and Chief of Hematology Oncology at Children's Hospital. You get the best children's hospital in the world, and that means the best focus on families and children. And you get one of the very best cancer centers in the world at the Dana-Farber Harvard Cancer Center with all of its really amazing resources by way of really smart people. So I think the combination of those two things is extraordinarily powerful. Being a physician makes you approach science in a way that's, I think, completely different than a person who does science who doesn't take care of patients.
Conclusion. Childhood cancer represents between 0.5% and 4.6% of the total burden of morbidity from this disease. This is indicated by the World Health Organization. The global incidence rate ranges between 50 and 2,000 cases per million children.
Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. Today's topic is pediatric cancer.
Pediatric cancer overall is very rare. It's about 2% of all the cancers diagnosed in the country every year. But that being said, there's approximately 15,000 cases per year in the country, and almost 1,500 children will die every year of pediatric cancer in the United States.
What is the most common form of pediatric cancer?
The range of pediatric cancers are very different from adult cancers. Most commonly leukemia and lymphoma, followed by brain tumors, and then other solid tumors such as neuroblastoma or Ewing sarcoma.